Hi everyone, my name is Monica. Today I'm going to discuss about Unit 8 journal assignment. Discuss what specific technique were used to change thought pattern in order to change behavior to the CBT. I'm going to list the question first and then we will go through it accordingly. Then discuss how you could implement CBT in your clinical practice in future. What specific diagnosis can DBT be used? In your current clinical encounter, have any of the session include CBT? Describe your experience with the CBT session. So, I would like to start with a brief definition of the CBT. Cognitive behavior therapy is a form of psychotherapy that helps individuals manage challenging thought, feelings, and behaviors by focusing on the present and modifying the negative thought pattern and behaviors. It is based on the idea that our thought, feeling, and action are interconnected and can influence each other. And by changing unhelpful thought pattern, individual can also improve their feeling and behavior. The key aspect of CBT is focus on the present. CBT typically focus on current challenges and problems rather than the delving into the past experience. Although past experience may be explored to understand their influence on present thought and behavior, but more so we're gonna fake most of the time we're gonna focus on the present negative thought pattern, especially in depression. I see last time 2 days before, like in depression we use CBT. It identifies the negative thought pattern, as I mentioned earlier. CBT help individuals to recognize and challenge negative or irrational thought that may be contributing to the problem. It also helped developing coping strategy. CBT provide tools and techniques to manage challenging emotion and develop healthier coping mechanism. It also helped behavior change. CBT encounter individual to engage in new behaviors or activity that can challenge negative thought pattern and improve their overall well-being. It is goal-oriented. CBT is often structured around a specific goal, and individual work with the therapist to achieve those goals. Short term and it is problem focused. CBT is generally considered short-term therapy, typically involving a limited number of sessions, and it focuses on a specific issue or problem focus. Collaborative. CBT involve a collaborative relationship between the therapist and the client, where they work together to identify the problem, set the goal, and develop strategies. How CBT works, I'm just going to do a little brief about it. Exploration of the thought, feelings, and behaviors. Individual discuss specific situation, thought, feelings, and behavior in relation to their problem, usually, and identify the thought distortion. It helps to identify the thought distortion, like what is the negative thought pattern, how the thinking is going, and how the consecutive negative thought pattern creating. We focus on that. Therapists help individuals to recognize common thought distortion like all or nothing thinking or catastrophizing. Challenging negative thought. Individuals learn to question and reframe negative thought, seeking more balance and realistic perspective. It also helps developing coping skills. Individual practice relaxation technique, problem solving strategy, and other coping mechanism to manage their challenges. Behavior experiment. Individual may encourage to engage in a specific behavior or activity to challenge their belief and gain new experience. Journaling and self-monitoring. Individual may be asked to keep journal and track their thought, feelings, and behavior to better understand their patterns. Benefit of CBT or a specific group of population where we use the CBT is CBT has been found to be very effective for a wide range of mental health conditions, including depression, anxiety disorder, including generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias, post-traumatic stress disorder, PTSD, obsessive compulsive disorder, OCD, eating disorder, insomnia, chronic pain, relationship problems, stress management. In addition to its effectiveness for mental health conditions, CBT can also be helpful for adapting to the medical condition and living with the chronic illness, coping with the grief and loss, and improving communication skill and developing a great self-awareness and self-esteem. Way to find as we discuss about CBT, I'm just going to go briefly about the CBT versus DBT as well, because we do have a question about DBT too. DBT is a little bit different than CBT, I would say. It developed a coping and emotional regulation skill, dialectical behavior therapy, and balance, acceptance, and changes. It is usually used in borderline personality disorder who have disorder, self-harm, and suicide ideation and trauma. The session it lasts 6 months and often longer than 6 months, which is pretty little longer than little longer than CBT. It also depends upon the individual as well. This is an individual therapy plus group skill training. It uses mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness, and emotion and behavior management. So I'm going to use all those techniques to empower my psych and P skill to have a better understanding and better grasp of therapy, so I can be a better provider and a counselor at the same time. Thank you so much for your time, and the uses of CBT and DBT have been very incredible experience, and I really like the approach itself. I hope I'm clear about the discussion. Thank you so much for your time. You have a blessed day.